Hi, everyone, and welcome back to the Aesthetic and Wellness Edge. I'm your host, Bethany Gifford, and this is the show where we uncover real world stories, strategies, and lessons that are shaping the future of aesthetics, health, and wellness. Today's guest is building a healthcare company that feels like a return to true patient care. But before we dive in, a quick word from our sponsor.
This episode is brought to you by New Era Intel. At New Era Intel, we help medical spas, dermatology clinics, and plastic surgery practices who are struggling with inconsistent patient retention, underutilized CRM systems, and manual systems that hold back your clinic's growth potential so they can finally increase quality repeat bookings, streamline operations with AI automation, and grow predictable monthly revenue with the right systems and strategy. They're able to create a premium, seamless patient experience while freeing up their team to focus on what they do best. If you would like to take your business to the next level, head over to neweraintel.com to get started.
Today, I'm really excited to welcome James Keppel, founder and CEO of Sarana Health. James is reimagining the patient experience with a model that blends functional and integrative medicine, all while keeping real human connection at the center. Unlike many companies these days that are leaning really heavy on AI-driven lab reports or generic health plans, Sarana takes a real human-first approach where every client starts with a 90-minute intake involving a physician, health coach, and a certified nutrition specialist, the same three experts who stay with the team throughout their journey. James, welcome to the show.
Hey, Bethany, how are you?
I'm doing great. We're
Great.
excited to have you here and learn about Sarana Health. Right off the bat, what makes your approach a little different from other functional medicine and wellness companies?
The key differentiators, that's a good question. Really, we focus very much on the one-on-one connection with people. As you mentioned, AI is, pervasive in what they call digital health. But, AI is great in some cases, and in other cases, it gives you really bad answers, and it depends on your prompting and all that sort of thing and how good the language models are. But it can't really replace knowledge, experience, intuition, the things that you get from dealing with people. So we really focus on that. As you mentioned, you get your initial team at your intake, and those are the three people you deal with for the entire time that you're in the program. It's not like a PA comes in and a nurse comes in and, all these different things, which just create all these opportunities for things to go wrong or information to not be communicated that could be communicated. So we take the approach where, as our client, you talk directly to the providers and they hear you directly and they talk with you directly. And it's a very straightforward approach.
That's huge. I was literally in the emergency room with a friend this weekend, and we had a new doctor and a new nurse every 10 minutes coming in, asking them the same questions. And repeat ourselves over and over. And I thought, oh my gosh, this is not only frustrating for the patient, but information could get lost.
Yeah, and I've been through that myself, which is part of the reason that I started the company, because I just saw the inherent functionality things that are wrong with the healthcare system right now, or could be improved, maybe not wrong. But having gone through it personally, and exactly what you said, a different doctor every time, different offices, and this doctor's not available until 6 months from now, and this one's available in 2 months, and it's just it really puts the focus on the patient to manage their own healthcare. And that's not the point. The point is that the professional should be managing your healthcare.
Yeah, 100% agree for sure. I mean, you had touched on, your personal journey leading up to this. And I know you had been kind of a serial entrepreneur prior to this. So is that what sparked Sarana?
Yeah, I came across a personal health issue. I needed an organ transplant, and they just tell you, yeah, we'll just take the old one out, put the new one in, and whatever, it'll be fine, right? I said, no, I don't think I want to do that. So I started looking at it from a very different angle, conferring with other professionals, and just sort of developing the Sarana Health approach. And the results for me was that my organ function is up by about 40%. And I'm basically medication free. I've got a couple of things I need to take for probably the long term. And, I'm kind of living proof of concept that this works.
I love that. Walking, talking billboard.
Right, right.
That's amazing. Well, I mean, you had design in your past, entrepreneurial in your past. How did that kind of help shape, building a healthcare company right now?
Well, everything. I mean, I spent a little bit over 20 years running a design firm in the San Francisco Bay Area. And, I didn't ever have anybody teach me how to run a business. I just started doing it. And, there were challenges along the way, every step. And you can take any business and it's kind of the same challenges. They're different flavors of the same challenge, but it's the same type of thing. The one thing that I really learned in my past experiences was about team building. And frankly, I just wasn't very good at it. And I kind of assumed that nobody could do it as good as I could do it and all this nonsense. And so when I started to build the team here at Sarana, I really focused on obviously the people and their qualifications, but also just really letting them go and do their thing. I mean, I'm not a doctor, first of all, I should say that. I'm in the healthcare business, not the care business. But I can't say to somebody, here's a better way to do that. So I have to put a lot of trust in the people that I've got. And across the board, we've never had anybody complain. People love their providers and they build a relationship with them. And that's the way healthcare kind of used to be,
Yeah,
and it's a lost art, unfortunately.
I agree for sure. I mean, you said you had interviewed over 70 positions before hiring like your chief medical officer. What kind of qualities were you looking for and why was that so challenging?
Well, you had to have somebody who had the basic knowledge because there are MDs, but then there's a DO, which is a doctor of osteopathy, and a DO knows everything an MD knows plus. They know the integrated model. So number one, that just narrows the field quite substantially right there. Ironically, our CMO is an MD, not a DO, but he knows everything that a DO knows. So he could be a DO if he decided to. But so that was one of the qualities that I really looked for, and really the ability to communicate with people. Because a lot of times when you see a doctor, a lot of stuff just goes over most people's heads and they just kind of nod and say, yeah, 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 but they don't really understand what's going on. So I wanted people who could really explain things at a very understandable level, not just come in and give me a bunch of medical jargon and say, that this does that and all that sort of thing, but really tie that into real world execution in whatever the plan is. And, that quality is hard to find. On top of that, the healthcare industry in general is severely lacking for people. There's just not a lot of people going into it anymore. And so that kind of narrows the field. Plus, we're an early stage company and it's not like we're throwing around big salaries or anything like that. So I had the same conversation 70 plus times. The doctor would say, I don't like the healthcare system. I don't like the way that they tell me how to treat my patients. I don't like the fact that the pharmaceutical companies are driving this. I don't like the fact that I have to deal with insurance companies. And I said, okay, fine. All that, throw it away. Forget it. Doesn't exist over here, right? And I said, that's great. When can I start? And where's my $500,000 a year salary? So, so you have to have people who are willing to take a risk. Medical professionals generally are kind of risk averse. So it's a matter of finding the right people with the right personality, with the right skills. And, we're a team-based approach too. So they've got to be able to deal with other people. I didn't want a doctor with a big ego coming in and saying, I know everything, because nobody knows everything. So when you put your nutrition specialist and your health coach and your physician together, you're getting 3 times as much knowledge in one sitting. So that was an important part of the development of the company.
Absolutely. Personalities are everything, not just, educated or professional, but you got to be able to work with your staff and your teammates and coincide and everything and be a people person for your clients. I mean,
Well, yeah, and you're right. There's 2 sides to it. Number one, can you function in the company? And number 2, how do you deal with our client? And those are hard qualities to put all together, but I've been lucky. I'm really proud of our team. Everybody is at the top level of their qualifications and certifications, and they work really well together. There's no egos in the room, and it's a beautiful thing.
I love that. That's so good. It's good when it all comes together for
Yeah.
sure. Well, what kind of trends, in functional and integrative health are exciting you guys right now?
Well, the biggest one is that people are becoming aware. Yeah, there's a portion of the population that says, "Yeah, I eat at Carl's Jr. or McDonald's or whatever every day," and that's great. But we find that in general, people are aware. They want to be on the front end of things, which is where we live. We're not there to help you when, well, I mean, we can, but we're not there to help you when you're already sick. The idea is to never get you sick, right, or have you get sick. So the trend toward people understanding about prevention, being aware, wanting to maybe make some adjustments to their lifestyle, to their diet, those sorts of things. There's a giant audience for that now, and that's a cultural shift that we've seen over the past 10 to 15 years.
Yeah, we've seen a lot of it, especially we started kind of in the aesthetic side. And everybody's wanting to integrate health and wellness into their practices now. And more, we're seeing integrated health clinics pop up all over the place, but none that can be accessed all around the United States. So
Oh,
you guys,
that's a big issue. As when I envisioned the company, I said we can be a small private practice and small-ish private practice and have a few doctors and do the normal thing, or we can bring this to the public consciousness. I've got my axe to grind with the healthcare system, so it was important to me that we could scale, and we started building to scale from day one. And the idea is to get this into as many people's hands as possible, raise the awareness, and hopefully make a dent in the legacy healthcare system where they realize and they say, hey, look at what those guys are doing over there. Maybe we need to do more of that for real, because there are a lot of healthcare systems that say, oh, we've got our wellness program, or you got a corporate wellness program at work or something. They vary in quality, of course, but I can tell you, I went through one major provider's program myself in the early days of my condition, and it was just a funnel to get you to all the regular stuff. So you'd come into the wellness clinic and they'd say, okay, well, we've decided that you need to lose weight. Weight loss clinic is down the hall to the left, 3 doors down. Check in with us maybe if you want to ever, that kind of thing. And it was just, there's a lot of stuff out there that just isn't as real as we'd like it to be.
yeah, people are missing the mark, all cut up in the system for sure.
Yeah.
I mean, you have a huge different diverse client base too. We had talked about previously. It's kind of a even split you had mentioned between men and women across
Yeah.
like a wide age range. How has that kind of shaped your messaging?
I was kind of surprised. Early on, we decided to do a professional market study, so it wasn't a bunch of Survey Monkey emails. Not that there's anything wrong with Survey Monkey, by the way, but we had a professional healthcare market research thing done, and we had 1,500 pre-qualified respondents, and I was blown away because I expected it to be weighted more heavily toward women. It was like 49 to 51% or something like that. And we found that there were some surprising hotspots throughout the country where people were just really super interested in what we were doing. And the age range, I pegged it originally at about 35 to 65. And because that's when you start to become aware, you start to think about where you're going in 20 years, 30 years, whatever. But we found now that it's skewing a lot younger. And we've always thought that we could deal with older also. So, now we say it's kind of like 25 to 75 and everything in between. So it's clearly something that people want. And that's the important part.
Absolutely. I know the younger generation these days, they're just obsessed with it. They're obsessed with putting good things in their body now. I mean, at that age, we
Well,
were not like that.
I've got some ties to the loose ties to the entertainment industry. So I go to a lot of concerts, and I was at one the other night, and I was looking around and going, how do these places stay in business? Nobody's drinking. It's like, it's like two people holding a beer in a crowd of 750 people. And it's great that that's happening. But if you look at all the numbers, especially with alcohol, it's kind of like taking the same nosedive that cigarettes did at one point.
Yeah.
It used to be everybody did it, and then it became hardly anybody did it. And then we're seeing the same kind of trend.
Our youth is seeing the damage that it's done to our generation and older. And I think that they're waking up and wanting more natural routes and more effective ways to live longer, and substances aren't that way. So
It's the awareness thing. That's it. If you are aware and you want to educate yourself and you want to make some adjustments, and I just want to be clear about one point. When you come and work with us, we don't turn your life upside down and say, you're doing everything wrong. Here's what you have to do. So what we do is we look at what your current lifestyle is, and that involves a lot of things, behaviors, nutrition, all that sort of thing. And then we adjust around that. So if you like a certain type of food, and what purpose would it be if we said, okay, you can't eat that anymore? So instead we say, okay, maybe you need to cut back a little bit and eat this also because it balances it out. And that's that integrated wellness approach where everything has an effect on everything else. And until you get in front of it, it's kind of hard to see that how complicated the system is. I always say that the body is a complex system of very complex subsystems, and it's great that people are seeing more of that. They read more of that. Dr. Google is an unfortunate competitor sometimes, but it's good to have the information. And then if you go to the right people who know how to craft the information and make it useful for you, that's even better.
absolutely. What would you say are like the top things that people come to see you for usually?
Well, I always zoom in on diabetes because in my mind, I think it's technically an endemic or a pandemic. I think it's an endemic, where the numbers are staggering in the United
Yeah.
States compared to the rest of the world, really. And the number of people who are pre-diabetic is staggering also. The number of people who are pre-diabetic and don't know it, that's the scary one because nobody's ever told them. It's like, well, don't eat that. That's great, but why? And what affects what, and how does it all work together? It's an important shift.
Yeah. I mean, for someone who is considering investing in their own health, but kind of unsure where to start, what advice would you give them?
Boy, I get questions asked of me often about how I solved my personal problem. And I said, I wanted it. That was it. It's like, if you want it enough, then you're going to do the things that you need to do. You're going to make some mistakes and things are going to go sideways sometimes. But if your general goal is, I want to be healthy, I don't want the last 10 years of my life to be miserable, I don't want a CPAP machine, I don't want all these things, then you're started on the road. The next step, obviously, is to engage with some professionals. And as an example, we offer a 30-minute free health talk, and it's not a marketing call. Okay. I test the competition every once in a while and it's like, okay, you get a free 15-minute consultation. 2 minutes of it is about your health, and the other 13 minutes is about how they're going to market the company to you. So our free 30 minutes is your first start into the program, and we aim for it to be useful. If somebody goes through and has that talk and they're informed and they decide not to work with us, that's fine. We've done something, and we give some things away as far as dietary recommendations and that sort of thing. But so to start on the path, in order to finish, you must start. Okay, or as they say in auto racing, to finish first, you first must finish. So, it's I always worry about when people start talking about exercise. Okay. I go to the gym every morning for an hour and it's just like something I do. Okay. But for a lot of people, it's like, oh my God, I can't possibly do that. It becomes this real thing where that's the roadblock. So we
Yeah,
try and just knock down as many roadblocks as possible. So you get started and you have fun doing it.
I love that. Kind of meeting them where they're at, which is really important, especially
Yeah.
for people who really haven't invested into their health, very much, and now they're wanting to start and not getting super overwhelmed with 100 million things you have to do and take and be. And yeah,
Yeah.
that's good. I like that. I like the approach for sure.
And when we create the roadmap for people, the important thing about the roadmap is that they can actually follow it. So if we put up a bunch of roadblocks, then they're not going to have success, and that doesn't help them, and it doesn't reflect well on us. But that's kind of beside the point. But just getting going is always hard with everything, but when it becomes habitual, it's great. So like I'm the guy in the aisles at the grocery store who's reading the labels on the stuff that I buy. Okay. And I can look at any label and in 3 seconds I know whether I want to eat it because I look at sodium, I look at carbohydrates, I look at fiber. I got my mental checklist and I can do it just as fast as anybody else. I can get through the stores fast, but I take the time to do that. And that's where the awareness thing comes in. And that's where the education comes in. And that's where the wanting to do it comes in. It's the matrix, it all works together.
Totally. Well, for our listeners who are wanting to check out Sarana Health, what is the first steps between contacting you all the way to a treatment plan?
Well, the 30-minute health talk is where you start. And then after that, we've got a very simple 4-step process. And it's more complicated than the 4 steps, but just for a general way to think about things. Number one is you do an intake and discovery meeting with us, and that's 90 minutes. And I will challenge you to find me a doctor who spends 90 minutes with anybody. Okay.
No. Yeah.
So you got 90 minutes and you have all 3 people on your care team in that call for the
Wow.
entire 90 minutes. They're not running in, running out, all that sort of thing. So that's step number one. Step number two is that we send you to, we get lab tests done, and I'll explain that a little bit more. But we have a proprietary set of labs that we've developed, and we haven't developed any new labs. We've taken the ones that are out there that are certified and proven and that sort of thing, but we put them together in a unique combination. And you don't have to go to the lab. We have a network of 2,400, over 2,400 now, phlebotomists throughout the United States, and we find the closest one to you, and they come to you, and we don't charge any extra for that. You don't have to leave the house. Okay, so that's step number two. Step number three is we analyze the data that we get back. And it becomes sort of a math problem at times where it's okay, element number one is at a 3 and element number 2 is at a 10. But where we'd like to see it for you is we'd like this one to be a 5 and we'd like this one to be a 6. So you got to figure out all the ways to make those two things happen. And then when you get your follow-up labs, you find out how successful you are. And, be clear, it's an iterative process. It's not like you do it once and it's over. It's a constant sort of thing. And then the next step is the roadmap. And you put that roadmap together. It's got to be something that people can follow. And you've got the coaching aspect, which is very important. And a lot of digital health companies, they say you get coaching. Well, what coaching means is they send you a text message and they say, did you do this? With us, you talk to your health coach and your nutrition coach separately 2 times per month for 30 minutes. And that's an ongoing thing. You do that all the time. And I joke with my team, I say, you got to be everybody's best friend. When they have a problem, they got to call you. So, if you take those 4 steps and you just think about that conceptually, it's fairly easy to get your head around. And I'd like to think it's sort of a common sense approach.
Yeah, very highly effective. Going back into a provider, once every 6 months to a year, I mean, we're not getting that much information. We're not getting accountability. We're not getting certain things tweaked if certain things aren't working. So I love that approach. I love that hands-on and constant appointment going. And
I'll give you a personal experience. Like 6 months ago, I was testing for one thing and it was super low. And then we made some adjustments and it was super high. Okay. So, okay, now it's time to back off and get it in balance and we make adjustments. It's an iterative process and wellness in general is an iterative process. It
Yeah,
doesn't just happen.
I agree, 100%.
Uh,
Well, for our listeners, where can they sign up? Where can they find you? Where can they ask questions?
if you visit our website, there are links all over the place to schedule your health talk. So if you want to go directly there, it's sarana.health. And that's a good place to start. You can always drop me an email if you'd like to get involved. I'm James at sarana.health and pretty easy to find. So that's really the first step. And you've got to fill out a couple of forms before we start, just so we can talk to you openly about things. But it's super easy. I told everybody when we were developing the program, said that initial form filling out, you go to the doctor and you get 20 pages about did you break your leg when you're 2 years old or whatever. So I told our team 10 minutes. That's it. That's what, and we timed it. We tested it on like 30 people. How long did it take you? This one took 8 minutes. That one took 12 minutes. And then we figured, okay, 10 minutes is too little. So we made it 15 minutes. But, it's it's very easy to get started, I guess is the point.
Absolutely. Well, I love this about your approach. Easy, no nonsense. You can access it from anywhere. I think it's an amazing thing. And I'm really looking forward to seeing where you guys are going in the next 3 to 5 years. Do you have any big plans for the company?
Well, as the founder, I've got really big plans, but if I dial that back to reality of the next 3 to 5 years, we're developing new programs, but I don't want to have like 30 things that you have to select from. So we've got a couple of programs that pretty easy to decide which one you want to fit into at various price points and that sort of thing. Our goal is to be treating about 12,000 people per year. And
Wonderful.
that's, it sounds like a lot and it is a lot, but we've figured out the process and how can you do that. And this is a very important point. We are not a technology company. Okay. So when people throw us in with digital health, I'm like, wait a minute, that's like telehealth and you get whoever answers the phone or whatever. So we are a human powered company. And the technology we use to support what we do, but it's not the thing that we do. So we use AI on the back end and we use it for kind of the standard stuff, but we're not diagnosing using AI. So that's a major difference. And the other companies that are starting to pop up out there that are going down this route, I'm not inside, but my speculation is that they're all doing kind of the same thing. You get your tests, you get your lab tests done. AI kicks out an answer. They give you some sort of a plan, and then you go back in 6 months.
Yeah. Yeah. I mean, we love AI. We're all about it doing our systems and places and tools, but there's just a huge time and a place. And I could not agree with you more that when your healthcare is involved and one-on-one treatment plans, you need that human touch for sure.
Yeah. Yeah. And I'm not knocking AI. It's great for the right things,
Absolutely.
but I think at times people are using it for the wrong things.
Yes. Well, James, thank you so much for giving us kind of a sneak peek into Sarana Health. I have a very good feeling that this is going to be in everybody's purview going forward. So kudos to you and all the growth and everything. I think it's just going to really take off for sure.
Right. Well, thank you for letting me ramble on here for 20 minutes or
Oh,
whatever.
no, thank you. Thank you so much for sharing your story and the mission behind it. And to our listeners, make sure you reach out and check out Sarana Health. And if you enjoyed today's episode, make sure to subscribe to the Aesthetic and Wellness Edge whenever you listen to the podcast. Don't forget to leave a review. It helps more leaders and innovators find the show. And until next time, I'm Bethany Gifford, and I'll see you on the next episode.